In honor of my upcoming presentation with Learn Sex Therapy, I thought I'd give you a little office tour, but a little different. I'm going to show you around my office of all the different intrusive thoughts I've had during my day in my 6 years being in this office. I'll start with my most common one, which is right down here. There is this beautiful edge right here in my office, and you have no clue how many times I have the intrusive thought about stabbing my entire face against this really, really sharp edge. So the way that I respond to that thought, I go, woo! Well, that was violent. Let me keep on typing. Welcome. One of the other ones that I have really quite regularly is the image of my head being stuck in this microwave. So anytime I open it and I'm making my macaroni and cheese for lunch, I definitely consistently have the intrusive thought of stabbing or of getting my head stuck in it and microwaving it. That happens quite regularly. You'll kind of notice the theme. I have a lot more violent obsessions and intrusions, but let me introduce you to one of the SOCD ones. Come on. Have I definitely had the thought about this randomly sticking up inside of people? Yes, I have. They're just bubbles. So this is a new one actually. So this is my beautiful glass thing. Have I definitely had random thoughts of this being, of me putting my head through this entire piece of glass and then putting those glass pieces in places that they don't normally would be seen? Yes, I have. The way in which I deal with that particular intrusion, again, I use funny voices. I go, wow, that was a really funny creative voice you got right there. I guess I'll just maybe do that tomorrow. And I love to really intervene with those intrusions with different, I'm gonna say humor, but really just being able to acknowledge it, like that is just a thought. Is it an option that I could do that? Yes. Am I going to? Probably not. But again, I can't give anyone certainty, but I feel confident in my ability to not shatter the glass. So that's one of my new ones. Let's go see another one that's kind of old. Come here. Welcome to my bathroom, which is definitely a location that most of us who are OCD clinicians have definitely spent a lot of time in our bathrooms doing exposure work. The one that I have very regularly, both at home and the office, is what if there is a snake in the toilet, and when I sit down there, it climbs up and bites me in my labia. Yep, that is a thought I have actually quite often, and that one actually causes a lot of anxiety in my body. So what do I do when I'm sitting on the toilet going potty? I go, whoa! Okie dokie, that's just a thought, and I stay there. This one actually causes a lot more anxiety than some of my others, so I can feel my SUDs, or subjective units of distress, going up. Anytime that happens, I acknowledge that that's a thought, but what I do not do is I do not check before I go potty. I just sit there. I don't immediately run off the potty anytime I have that thought or intrusion. That means I have to sit with the image, and it is a very visceral image of the snake coming up and biting me in my labia. So thanks, brain, for that fucking one. Another one in the bathroom. Welcome to my penis soap. Do I have the thought very regularly or randomly intrusively pop into my head of what if I take the penis soap and stab myself in the eyeball with it? Yes, I do. So this one, I do have that thought occasionally, and I just have a thought, let the image pass through my mind, and I go, well, that was a thought I had. Moving on. This is one I used to have a lot more often than I do now compared to when I moved into the office, but my patients sit here on this beautiful couch, and then I have my wonderful art pieces done by my tattoo artist, Tim Mueller. Do I have the thought very regularly of what happens if the art piece falls on the patient, smacks them in the head, and kills them? Yeah. The problem is when I'm sitting over there in my chair, when I'm sitting there over in my chair, I can't really do much about it. So then what do? I guess I just have to sit there and be like, okay, that's a thought I'm having. Keep on listening. I focus and I refocus my thoughts on specifically what the patient is saying, bringing myself right back into the moment. That one used to be a little bit more difficult. The more and more I would practice with that one, the more and more that intrusion would go down. But occasionally it would burst and I would go, woo! Okay. Let me intervene in that way. That's the thing about intrusions. You are going to have intrusive thoughts for the rest of your life. It is how you respond to them. That's really where therapy and therapeutic interventions come in. It's not, how do I never think this again? It's just, how do I believe it to just be a thought, and that's it. No moral judgment, no implication, no thought action fusion, no implication of what it means about you as a person. You have a thought. It just means you had a thought. Thanks, OCD. Now go fuck yourself.